So I've been watching a really normal amount of The Pit. It's a new TV show about the emergency department in a Pittsburgh hospital. And the very first episode has this line of dialogue.
Boarding is a nationwide problem.
The show is fiction. The hospital it's about doesn't exist. But she's talking about a very real problem, one that's happening around the country and also here in Indiana. I'm a health reporter for WFYI in Indianapolis, and I partnered with the Associated Press to do a story about long wait times at the ER. We wanted to find out what's causing it and what, if anything, is being done to fix it. One person I spoke to was Tracy Ballhan. Her dad, Bill Spear, passed away last year after a long struggle with dementia. So, okay, this is Tracy on the right holding a photo of her dad, and then that's her mother, Bonnie. Bill spent a lot of time in emergency rooms, and during one stay, Tracy says he spent 12 hours in the ER of Endeavor Health in Naperville, Illinois, just waiting for a psych evaluation.
He was strapped down. There was nothing he could do. So he was like banging his head, like doing the things where he was kind of thrashing around in the bed.
The AP data reporter I worked with, Katsuri Punanjati, found that 1 in 6 visits to the emergency department in 2022 that resulted in a hospital admission waited 4 or more hours. Experts told me that part of the problem is a lack of staffed hospital beds, and hospitals tend to prioritize scheduled care patients whose insurance companies will reimburse them better for things like cancer care and orthopedic surgeries. Age is also a big story here. Just about 50% of the patients who were boarded for any length of time were 65 and older. So that really worries experts for a number of reasons. One bit of research found long ER stays could be linked to a higher risk of dementia patients developing delirium. That's a temporary state of mental confusion and sometimes include things like hallucinations. Several national organizations, including the American College of Emergency Physicians, have been advocating for systemic changes on the policy and hospital levels to help tackle ER boarding. But those groups say that the effort hasn't really moved the needle far enough. When I talked to Tracy Ballhan, she said the emergency room experience has really stuck with her.
People didn't look at my dad as a man when we were going through the worst of it. It didn't feel to me like he was being treated with any dignity.
There's a lot more to this story, so visit our website at WFYI.org to see the whole thing.